Hello everyone. This is Dr. Santosh Kumar, founding director of Momentum Orthocare. What does this Momentum Orthocare mean? Momentum Orthocare is not a hospital. It is a team of highly dedicated healthcare professionals and highly qualified orthopedic surgeons. We are a team of around 8 to 10 orthopedic surgeons and around 20 to 25 other associated healthcare professionals. Whenever we talk of surgery, whenever we talk of results of surgery, whenever we talk of the innovation and the inventions, it's the human resources that matter. It's the soft skills that matter, the skills of the surgeons that matter. Whenever we talk of the results of a surgery, it's the skills of surgeons that matter, it's the teamwork that matter, because no one can be as good as the whole, all of us. And this is what is Momentum Orthocare. We are the fuel, we are not the car. What it means is that Momentum Orthocare is not a hospital. It's our team of very dedicated orthopedic surgeons and healthcare professionals. We work together as a team. We discuss every surgery individually as a team. We discuss each and every surgery. We plan each and every surgery as a team, and we execute as a team, and we follow up as a team. So we continuously enhance our skills and follow-ups, and we continuously upgrade our skills, and this is what is Momentum Orthocare. We have been making several healthcare videos, informational videos before this, and today we will be talking about knee replacement. Well, knee replacement is one of the most common surgeries performed in medical sciences today and in orthopedic surgery today, and it is a life-changing surgery when it comes to people who are having bent knees and having difficulty in walking. Well, knee replacement is done in advanced arthritis of knee, wear and tear of the knee. So wear and tear of knee is not a disease. It's a usual process of aging or usual process of wear and tear. Like if we see our knee joint, this is our knee joint. So it's a junction of two bones. This is the thigh bone and this is the shin bone. And in between this is the cartilage. And this cartilage is a smooth cartilage ligament complex is there. There is not only cartilage, there are ligaments. There is meniscus. There is a washer shaped cartilage called meniscus to enhance the congruity between the joint. So this is the whole structure of a knee joint, and then there are collateral ligaments. There are collateral ligaments, outside ligaments. There is internal ligaments, and this is washer-shaped cartilage called meniscus. Now, as time progresses, this goes into wear and tear, which is known as primary osteoarthritis. This primary wear and tear is known as primary osteoarthritis of knee. Along with this, we have certain secondary osteoarthritis wherein there is a specific cause of wear and tear, like it can be some rheumatoid arthritis, it can be juvenile chronic arthritis, it can be a trauma fracture which has led to early wear and tear. So all these things are also there, but most of the cases are arthritis, whatever may be the cause of this arthritis. Once the arthritis has developed, what means arthritis means this, there is wear and tear of the cartilage and the ligament. This is the wear and tear of the cartilage, ligament, meniscus, everything is worn and torn. So this leads to pain. There is pain, there is stiffness, and there is deformity. There is swelling. Deformity means bending. The normal knees which are supposed to be straight like this gradually start bending like this. So there is pain, deformity, there is bending, and all those things are there. So the symptoms that one encounters is initially to start with pain which is more on climbing stairs, pain which is on walking. Then gradually there is rest pain also, pain while sitting and lying down on chair also, lying down in bed also. Any pain to start with is pain which occurs only in walking, but then gradually it converts into rest pain. There is burning sensation which is known as neuropathic pain, and there is stiffness, means there is difficulty in bending and straightening of knees, and there is instability because the knees are bent like this, because the knees which are supposed to be like the right hand side is the healthy knee, and the left hand side the knees have started bending. So on progressive deformity, the knees bend like this, the knees bend like this, the knees bend like a bow, and this bowing of knees leads to instability. The person has a waddling gait, and that leads to enhancing of the spine problems also. And then several times there is radiculopathy, that means pain coming down from spine to the legs, thighs and legs, which is known as nerve pain, radiculopathy. So this is the whole problem of osteoarthritis. We do an X-ray to diagnose osteoarthritis. This X-ray is generally both legs, X-ray of both knees standing. So this is how an advanced osteoarthritis X-ray looks like. This is an X-ray of advanced osteoarthritis of knee, and you can see worn and torn, wear and tear of the cartilage. This is how an X-ray looks like, wear and tear of the cartilage, and this is how the knees in osteoarthritis look like. There is bending of knees. So there is bending or bowing of knees, and if we are concerned about the entire leg, and if we see the entire leg, there is bending. Like this is the straight one, this is valgus deformity, and this is varus deformity. Majority of the deformities are varus deformities. That is bowing, and sometimes there is outward bowing, which is known as valgus deformity. So this leads to instability. In early stages, like in very early osteoarthritic stages, we treat with certain dietary supplements like collagen peptide, and the single most important thing that we can do is enhance the strength of the muscles, because the stronger the quadriceps and hamstring, the knee muscles, less likely is the wear and tear. Nowadays we also are working upon doing research upon stem cells and all in early stages, but that's in pretty early stages. Once deformity develop, we have to do knee replacement. Now what is this knee replacement? Knee replacement is like once the cartilage and the surface has worn out, so this is causing pain, stiffness and instability, and there is bending, like it has bent like this. So we replace this surface with a new surface. So we replace this surface with a new surface, and this is what is knee replacement. This is resurfacing. This is bringing in a new surface. This is resurfacing and realignment. Realignment means the bent knees are again corrected. Like the hip, knee or ankle, after surgery, we bring the hip, knee and ankle in one line. So this is resurfacing and realignment. We are putting in a new surface. So basically this is resurfacing and realignment. This is what is knee replacement. Well, this knee replacement can be total knee replacement, in which both the surfaces are replaced, or it can be unicondylar knee replacement. Unicondylar knee replacement can be we will show subsequently, in which only the inner half is replaced. If only the inner half is replaced, it's called unicondylar or partial knee replacement. Well, before knee replacement, if somebody is having significantly high weight loss does decrease the pain. So we have to aim at weight loss. Weight loss will decrease the pain. We have to aim at weight loss. So knee replacement is a treatment of end stage arthritis of knee, and it is a life-changing surgery in which the bent knees are corrected. Like if you see this person legs are so bent before surgery, and immediately after surgery the legs are fully corrected. The legs are fully aligned and straightened. So this is within a fraction of an hour, then the bent knees are corrected, are aligned, realigned and straightened. So this restores painless and stable movement. Knee replacement is a surgery to restore stable and painless movement. So in general, this is a life-changing surgery. So when we talk of the components, this is called a femoral component, this is the tibial component, and in between this is ultra high molecular weight polyethylene. Now the metals that are used in knee replacement can be cobalt chromium, because it can be cobalt chromium. The reason why cobalt chromium is used is because it can be highly polished, the most highly polished. And along with this is the tibial tray, and this is the ultra high molecular weight polyethylene, and this is a mobile bearing knee. So this is a mobile bearing knee, and knee replacement is there are several innovations in knee replacement now. Like we have shifted from fixed bearing to mobile bearing knees. This is one of the innovations. And presently we are also using this titanium niobium knee, and this titanium niobium knee it can be fixed bearing or it can be mobile bearing. Like this one is a mobile bearing. It moves like this. For sitting cross-legged, it moves like in two axes. It moves like this, and it moves like this also. So this is a mobile bearing knee, and mobile bearing knee is really a revolution in knee replacement as far as it is concerned. Along with this, nowadays we have medial pivot knee. We are trying to make implants as natural to knee as possible, because natural knee is mobile. Natural knee, there is a rotatory movement also along with flexion and extension. So mobile bearing knees are innovation in knee replacement, and along with that there is medial pivot knees which we are doing to mimic as natural to the natural knee as possible. And one must realize that the single most important thing in any knee replacement surgery is the precision of the surgery, because it's all biomechanics. It's all biomechanics which is based on the millimeters, degrees, and the precision. And this precision can very well be done with manual instrument. The expertise of the surgeon is the single most important factor. Or it can be done with navigation. We do computer assisted surgery, we do computer assisted navigated surgeries, we do a lot of we have extensively used the orthopilot navigation, and presently we are also using robotic arm assisted surgery. Like this is a robotic arm assisted surgery. This is the robotic arm which we have been using. So these are all to enhance the precision of the surgery. This is our robotic arm that we have been using. This is our robotic arm. So all this is to enhance the precision of the surgery. This is the robotic system, whole setup that we have been using. So this allows for increased precision and simulation of the surgery. And to understand what is partial knee replacement, well, this is the X-ray of a total knee replacement in which both the surfaces have been changed, and this is partial knee replacement in which only the inner side has been changed. Well, but partial knee replacement cannot be done in every cases. Most of the patients that will come to us are having deformity, bending of knees. Once the bending has appeared, it's better to do total knee replacement than partial knee replacement. So if it is early stage or there is correctable bending, then we can do partial knee replacement. And presently we are using high flexion knee, personalized fit knees, which we will be showing you. We are using presently personalized fit knee or the persona knee. Persona knee is a personalized fit knee. Along with that there is attuned knee, which is also personalized fit knee. Means there is every 1 millimeter increment. The sizes are variable to very big extent, and everything can be personalized for you. And presently we emphasize on high flexion technique. Like see, this is the knee bending of knee just 1 day or 2 days after surgery. So high flexion knee, we are using high flexion technique. High flexion is not just a implant, it's a technique. So we are using this high flexion technique to bend the knees and to demonstrate how the deformity gets corrected. See, this is the bending of the knee before surgery, and this is after surgery. So how the deformity gets corrected immediately, and how a patient is able to sit cross-legged, after a few weeks of knee replacement. So this is high flexion technique is in accordance to the Indian lifestyle to allow a person to sit cross-legged. And this is a photo of a knee which is before surgery and after surgery. See how much of bending deformity has been corrected immediately after surgery. So another photo I have to demonstrate. This is the photo of the knee on the bed before surgery, and this is after surgery. Within few hours, the whole deformity, the bending of knees has been corrected. So this will the bending of knees, that is the deformity, leads to instability and inability to walk. So knee replacement completely corrects the bending and the deformity and straightens the knee, and thus it restores the stability and balance at the knee. And to keep the person more and more painless, we have been using nerve block techniques. We have been using selective sensory nerve block to minimize the pain after surgery. And we also have been using stitchless technique, in which a person is the stitch removal is not needed, and after 4 to 5 days of surgery, person can take bath on his own. So this is stitchless technique, in which stitches are not put after knee replacement. So this is what we have discussed in nutshell about knee replacement. If you have further queries, you are most welcome to mail us at santdr@gmail.com or WhatsApp us at 9831911584. So this is our Momentum Orthocare, and if you any part of the world, you are welcome to reach us, and we will give you the best and the safest and the most predictable at the most affordable prices. So welcome to Momentum Orthocare, the world's largest joint replacement team.